Good afternoon. I am joined today by Mayor Thomas McNamara from the City of Rockford, and we're here to talk today and give you some updates on some reporting changes that are occurring at the state of Illinois as we move through this kind of really phase 3 of the restore and reopen, as well as kind of the data that's coming out at this point. The state of Illinois, if you go onto their website today, is going to be reporting on what they call probable cases. And what is a probable case? These are epidemiologically linked, meaning they're part of a case contact investigation who have symptoms but have not yet had a confirmed laboratory test. And the predominance of where we would be seeing those are in the long-term care facilities at this particular time. Earlier in the pandemic, we might have seen it when there wasn't sufficient testing and people were part of an outbreak investigation and were told to stay home if they developed symptoms. But based on our local data for Winnebago County, we have 17 probable cases. 15 out of those 17 are associated with long-term care residents, or 88%, and 2 are household contacts. But our goal will always to get any contact, anyone who exhibits symptoms, to get them tested. And we have adequate testing in Winnebago County. You will also see that they are beginning to report probable deaths. And we've gone through this discussion as we've gone through the pandemic. And again, probable deaths are those deaths that, again, are epidemiologically linked, have symptomatic or have clinical signs and symptoms consistent with COVID-19, but do not have a confirmed laboratory test. We have only had 2 of those in Winnebago County, and those were early in the pandemic. We continue to make sure that all of our tests are completed with the cooperation of the coroner on anyone they are suspecting of a COVID-19. So if they exhibit symptoms or coming from a setting where COVID-19 has been diagnosed in one of our congregate or long-term care facilities, they will also then test. The state is also reporting on what they are now calling a recovery rate, which is different than numbers recovered. And the current state recovery rate is 92%. So you'll begin to see that that's a formula that's used. So they look out after really 42 days, which is approximately 6 weeks, which really reflects 3 incubation periods. So anyone that has been on a system for that amount of time is considered recovered according to state data. And that really does, for our health department, we've been able to keep up with all of our contact tracing, so we are able to close out our cases. But throughout the state, in places like Chicago and some of the collar counties where the case count was very high, getting back in to close those cases is difficult. And so the state now has moved toward a formula that's being used throughout the nation as well on this 42 days. And so instead of actual number recovered, we will begin to report the recovery rate. So as we look at this, come back to some important key messages here. Testing sites, we continue to encourage testing. And you know testing now is open regardless of signs and symptoms. If you need a test, there is testing capability available. All of our sites are open, whether it's the site at Auburn run by the Crusader Community Health, whether it is at the National Guard site at the University of Illinois Health Sciences campus. And now, of course, we've brought online CVS is also testing as part of that scenario. There should be no cost to that. At our stand-up community-based testing sites, no identification is required. There is no cost. And if you've been in a large gathering where masking or social distancing was not possible, please monitor for symptoms and consider getting it tested within 5 to 7 days of that gathering. We recognize that if people have been out, they may not have always been able to maintain social distance. The others around them may not have been wearing masks. You can get a test through one of our community-based testing sites at no cost. So I'm going to report some new numbers that I want to talk about. Today we're reporting 32 new cases for a total case count of 2,594. Our total negative tests are 22,887. We have no additional deaths to report. We're holding at 76. And with the new methodology reported by the state, we're reporting a recovery rate of 86.3%. Our positivity rate is running at 10%, 10.2%, which is the lowest since April 12th of 2020. So within 2 months, we really have gotten that positivity rate really coming down. We also want to give you an update on some good news about money that is coming in to the health department for contact tracing. The Health Department has been allocated $4.9 million for contact tracing. Our goal will be to hire 51 temporary, full-time benefited positions. Our model will be using a case management model, which is what we've used throughout this pandemic and throughout the outbreaks, is that there is one individual who takes in the information, determines, and then works through the case contact investigation to determine contact tracing, to determine what other psychosocial needs you might have, whether you need assistance with housing, food, how do you communicate with your employer, all of that. We will require a mix of educational requirements from high school graduates to graduate degrees, including clerks, disease investigation specialists, epidemiologists. Training will be provided for all positions. We are going to have specific teams to address outbreaks associated with our long-term care facilities. So as we move into kind of a recovery and response, we will have teams assigned to that rather than using our health department staff from other departments. We will now have a dedicated team. Congregate settings, child care and school settings. We expect to be able to anticipate as we ramp up, as more child care programs go into effect, that we will need to then also be prepared to respond to outbreaks in those, to support the school nurses in those community settings or some of the other staffs in theirs, and businesses, including manufacturers, warehouses, food distribution sites. Jobs will be posted on the Winnebago County website and recruited through social media. So we hope to get those positions posted in the next couple of days. Our goal is to get these positions on no later than June 30th. So we need to get the word out. This is the money that is coming into our county to support us in the response of how we can keep our outbreaks and our numbers under control.